Hi, everyone, and a big thank you to Inwardbound and the team for inviting me to give a talk really on psychedelics and psychiatry. So I'm Graeme Campbell. I'm a consultant psychiatrist, or I was a consultant psychiatrist in the NHS. Now I'm working as a trial psychiatrist. Maybe over the past year, I've been doing this, working with Small Pharma Limited, Imperial College, sort of collaborating with Imperial College and Hammersmith Medicines Research, who are a clinical research organization that run clinical trials for sponsor companies. So in this role, strictly I am employed by Small Pharma. However, we discovered fairly early on, in my job that there was an ethical conflict in that. And so I'm fully seconded to Hammersmith Medicines Research, which is the clinical research organization, with no previous experience of working within Small Pharma as a company. That was really on day 2 of my job. I think it's important to say that, I'm a clinician primarily. I've worked in the NHS for 17 years, and about 15 years of that as working in mental health services. And in my role as the psychiatrist for this clinical trial looking at DMT for depression, I'm behind an ethical wall, which means that I have no kind of activity in the business side of Small Pharma. My focus is entirely on the study and trying to ensure that the study is as safe and as possible, and that participants are looked after as well as possible. I also have a role as somebody on the advisory council for the Institute for Psychedelic Therapy. And so that's been really over this past year. And I run the academic circle. I'm the chair of the academic circle in IPT, which is really about reviewing the research and looking at the science and helping us all kind of learn from the research papers and all the work that's going on in the scientific and therapeutic space. So that's a little bit about me. Let's see if I can advance this slide. Yep. So really this session is going to be about psychedelics. It's going to be a bit about psychiatry. That's where the majority of my experience has been. So talking a little bit about psychedelic therapy. Is it safe? Does it work? How might it be working? What are the research challenges? I'm going to focus in the latter part of the talk quite a bit on the ethics. I'll say at the beginning really that, again, I've been working full time in this field for the past year, and ethics is I'm no stranger to ethics, working within the health service and working as a psychiatrist and working as an inpatient psychiatrist. There are a lot of ethical decisions that, we have to confront all the time, every working day, really. So I'm no stranger to ethics, but when it comes to the ethics of psychedelic therapy, I've certainly been learning from some of the elders and the people that have been doing this for a long period of time. So I've kind of gone through some of the papers, and I've kind of looked at some of the guidelines really that have emerged in more recent years to try and shepherd the field on a safe path for the people that are providing the psychedelic therapy, and also for the people that are participants. And then at the very end, hopefully I'll save myself some time to have a little think through what the future might hold, some of the challenges in the future, but hopefully some of the hoped for outcomes really with this field.